Hello and welcome to Fraud Talk, the ACFE's monthly podcast. I'm Paul Kilby, the editor-in-chief of Fraud Magazine for the ACFE. And today I'm joined by Theja Birur, Chief Technology Officer and founder of 4L Data Intelligence, an AI company that works to help healthcare providers and payers, insurance companies, and governments reduce fraud, waste, and abuse, among other things. Theja brings more than 20 years of experience in analytics and artificial intelligence, primarily focused on solving payment and quality challenges for healthcare payers and public health agencies. She's also the inventor of 4L Data Intelligence's AI platform. Theja's career includes work in the government sector with the Ontario Ministry of Health in Canada and with the California State Compensation Insurance Fund, where she was an associate director over big data and data warehouse function. He's also worked at IBM as a management consultant and in the IBM Innovation Lab focused on analytics. Welcome, Theja. Thanks very much for taking time to talk to us today.
Thank you, Paul. Thanks for having me here.
Not at all. So first, I just really wanted to maybe start, obviously, this is about AI. So I just really wanted to start and just talk a little bit about AI, because I think for most of us, it's a bit of an exotic, sort of esoteric area. And I was just hoping perhaps you could sort of simplify it a little bit for sort of the layman. I mean, there's been a lot of talk about AI, especially since the launch of ChatGPT in November, I believe, last year. But it's still a bit of a mystery, at least to me. So I just wondered if you could sort of describe it a bit, and maybe explain to us how it's perhaps different from sort of data analytics and machine learning that maybe some fraud examiners use to detect fraud.
Sure. So artificial intelligence is like a human intelligence. It's just artificially built to the machine. So we are programming the machine to think like a human being, reasoning, logic, and analytical skills. So it's very different from data mining, because in data mining, you know what you're looking for. You're kind of looking for answers for the questions. Whereas in artificial intelligence, you train the model and you're expecting the model to tell you some things that you did not know before. For example, a trend or a pattern that it's very hard to find just by doing a data mining.
Right. So I guess data mining is you're putting in data, you know what the data is, and you kind of know what it's very sort of focused. Whereas I guess artificial intelligence, in a sense, does its own thinking because it has access to all information.
Correct.
Okay. So, I mean, how far has this sort of technology come? I mean, how advanced has it sort of moved in recent years? I mean, I know I guess there's always a little bit of hype around these things when the press get hold of it. But is it really a sort of a game changer at this point? And how's it sort of advancing?
Yeah, since 2011, there is a lot of people knowing about AI. It has been there forever, for like almost 30 years, but more and more people are using it. When I started looking to see if I can find a patent on identifying fraud using AI, it was in 2017, and it was still kind of new. It was still, people were talking about it, but not widely adopted as we see it today. Mm-hmm. It's no more just a trend. It's become a part of our solutions for most of the technology these days. And ChatGPT is just another flavor that is added to it. For example, it makes the business users ask simple questions, and in the background, it will go and fetch the answers for it without having a programmer in between a business person and the data.
Right. I guess like a lot of technologies, it'll sort of get easier. And I mean, I guess ChatGPT has made it easier for sort of the everyday person to use it now, right? I mean, that's sort of and I assume just like computers, it'll sort of become a sort of, as you say, more commonplace and easier for everyone to access and use.
That is correct.
Okay, so now that's sort of established, I just really wanted to sort of get into your sort of main area, which is obviously healthcare and fraud in that area. Obviously, there's a massive problem, for lack of a better word, in the sort of US medical system, especially, with abusive billing practices, which account for billions of dollars lost every year, whether it's waste or abuse or fraud. I think I've got some stats here from which I think you've actually provided, but it's like from the National Healthcare Anti-Fraud Association. They're estimating that healthcare fraud costs for the nation are around 68 billion annually, which is about 3% of the nation's 2.26 trillion in healthcare spending, and that 3% goes up to around 10%, according to depending on who you're talking to. So it's 230 billion according to Blue Cross Michigan. So just a sort of basic question to start with here. It's I was trying to get a sense of why there is so much fraud in healthcare and abuse of claims, and why has this problem gone on so long?
Medical billing and medical coding is an extremely complex process. It involves permutations and combinations of diagnosis, which we call ICD codes, and procedures, CPT codes. So the conditions of the patient's age, comorbidity. So given all that combination and trying to find out if the code that was sent or the bill that was sent is accurate is an extremely complex process. And many rule-based system has rules built into it, usually following the CMS guidelines. But still, there are cases where a lot of this can be overridden by medical procedures that needs medical necessity, but you see bills coming without medical necessity, and it's very hard to prove.
Right. So the complexity of it all has sort of made it a very sort of particularly difficult area to sort of detect and prevent fraud in. Is that correct? And obviously, aside from the fact that there's lots of money to be stolen, I guess.
Correct. Mm-hmm.
Right. And then when you talk about rules-based, so what do you mean by that exactly?
So CMS, as a federal agency, has given guidelines, coding guidelines, as to what procedure goes with what diagnosis and how much of it can be provided. And I think it's extremely, again, complex articles that they publish every quarter, and it changes every quarter. So keeping up in track with just those rules itself is a humongous task. On top of it, rule-based is only looking for rules to say, if you see this diagnosis, this is the procedure, or this is the number of units you can provide. But if something else comes in the variation, that rule-based system cannot detect it. And that's where we use AI to see if there is a pattern of billing which defies the normal guidelines. It's very hard for a rule-based system to detect that.
Right. So at the moment, that's a sort of, I'm trying to understand what sort of controls are in place now that most or payment integrity systems that insurers and payers have at the moment. You sort of partly explain that with the rule-based stuff, but just to get a better understanding of how that works and whether you think that's sort of a bit dated. I assume you do, and whether why maybe the US health system has been so slow in adopting new technology.
So I would not call them dated. It's just they have built it for processing the transactions of a claim coming every day, right? There is volume of claims, and there's a time limit where this claims has to be processed. What makes it very complex is if there is a deviation to those coding guidelines, then these editing systems cannot catch it. And that's where the providers are using those deviations to trick the system.
Right. So that's sort of like just so I understand properly, it's like maybe sort of upcoding or diagnosis, a sort of different diagnosis for a patient that really isn't that ill, right? That sort of thing. Is that correct?
There is upcoding, there is unbundling, there is diagnosis for a different age group that is not applicable. There are so many to list, but yes, but they have found out a ways, for example, a home health services that may or may not be required for a patient is rendered, and how do you really determine if it was actually required for the patient? So then it kind of goes into what was the medical necessity, and how do you determine that this was a fraud? And
Right.
it gets complex really fast as you start putting all these combinations.
Well, I wrote just one story, and I spent ages just trying to get my head around how this all works, and I'm still a bit confused, to be honest. But so I mean, is it a question of whether, obviously, that's the way the system's developed, but have they been sort of slow in adopting new technology, or is this AI still so new that they just need to catch up on this front?
So the health systems are very complex. They have integration with many third parties. So when they have to make a change to their existing workflow system, it is not an easy task. It spans over sometimes even years. So for them to take on to adopting a new system, they really need to be committed to it. They need to test that and adopt it. And just based on the volume of transactions they have to do every single day, and for them to set aside time to then do that with a new system, I think it's quite daunting. And I understand their pain. So the way I see it is technology like Foral Data Intelligence should be sitting on top of their existing editing systems and find the outliers and either help them with the prepay or postpay.
So I'm just trying to maybe get some case studies from you. I know you had a few on your website, but I was trying to get sort of an idea what some of the typical frauds that you are seeing in the healthcare system, just from your perspective, particularly, in Medicaid and Medicare. I know you mentioned things like I think it was the Fountain of Youth doctor, which I thought was quite amusing, and some telehealth cases. But I just wondered if you could perhaps go into those and how AI, just so we can get a sort of narrative and better understanding of how AI might help in those cases.
Yes, I mean, some of the examples could be the telehealth, like you said. Recently, we saw COVID fraud. We saw there is a lot of DME, which is kind of public. Everybody knows about the knee braces, unnecessary knee surgeries that has been performed or billed for the patients, remote monitoring, home health. I keep bringing that home health and skilled nursing facilities. So there is so many areas where people can provide services or pretend like they're provided services for a patient under different entities. For example, a provider can register themselves with the 4 or 5 different entities, and they could be billing for the same patient from all those 4 entities, just because now they have an encounter with the patient. So these are all some of the schemes that we see when we look at the data.
Right. So how would sort of AI, help in that case? I mean, how would they sort of how would the technology sort of pick up on these kinds of frauds?
So basically, we are looking to see if there is a trend of this provider doing something similar over and over again to many patients. It's not just a one-off case. It's there is a trend because they have realized the insurance is paying for this bill, so they continue to do it. And you're trying to find those trends and patterns, and then you benchmark those providers with similar specialty providers for similar diagnosis. Then you kind of see where the outliers are. There's still investigations needs to be done when we find some of these outliers, but that's a start where we say there is an anomaly or an outlier behavior with this provider.
So in other words, the providers sort of, I don't know, I'm just trying to come up with a sort of an example, but so the providers sort of are billing for a lot of, I don't know, cancer patients or people who need sort of prosthetic limbs or something like that, and that's not sort of normal, I guess, compared with others, and then you pick up on that using AI.
Correct. So for the similar patient with similar diagnosis and comorbidity, what was the evidence-based medicine saying? So we do refer to evidence-based medicine heavily to see past 50 years, what was the typical treatment duration and the outcome of those treatments versus what we are seeing with this provider.
So you would basically, I mean, the artificial intelligence technology would just sort of scan, I guess, providers. Is that how it would work? And then they would just say, hey, well, just suddenly pick up that this particular provider is slightly different in the way he or she is billing.
Correct. So we are looking at it from the provider's lens, right? We are looking to see his billing patterns, his treatment patterns, and comparing and benchmarking him to the other providers with similar specialties working with the similar kind of patients.
Okay, and how I'm just curious because I don't know much about this technology. So how would you do? Would you just type in a sort of an instruction, would you, and then the machine would sort of come back with a sort of with an answer? I mean, how does it, or is it more complex than that?
Yeah, it's more complex than that. So we kind of categorize it by different procedures, for example, and then say what procedure can be given for what kind of ICD for the diagnosis, and how the other providers have given the procedure for a certain diagnosis. How long did it take for this particular diagnosis to be cured? Things like that. We have built a corpus, and that will help us determine if anything is an outlier. It will trigger off and say there is an outlier procedure that is given consistently by this provider.
Just how many people are actually using this AI now to sort of catch sort of this kind of fraudulent activity, or is it still fairly new?
It's probably fairly new, but more and more people are getting into it. More and more payers are looking for solutions to solve some of the problems that they are facing. And I think it can be done with the cooperation with the payers, working with the payers very closely, and making sure some of the outliers that we trigger is actually a true positive, and it follows some of the business rules, business processes.
Are you mostly working in the States, are you, or do you sort of work sort of internationally with? I'm just curious if this is sort of a uniquely, I mean, I appreciate fraud probably happens in every medical system around the world, but I just wondered the scale of fraud because of the complexity and the amounts of money that are involved. I just wondered if the US is different.
Yeah, US is huge. US is big in terms of population as well as the complexity of the healthcare and the guidelines. But US is also one of the few countries which uses the procedure codes as part of the guidelines, whereas most of the international countries do only uses the International Code of Diagnosis to be able to say how much it needs to be paid. So that kind of makes it simpler from the payer perspective. Versus here, we have the combination of procedure and diagnosis and the comorbidity. And like I said, the patient age and the condition and the gender, it just adds up the complexity much more than what I've seen in other countries.
Right. I guess because there's so many different ways of assessing claims, right, or paying for claims here. Because I mean, from what I remember, Medicare Advantage is a diagnosis code.
Medicare Advantage is a supplement insurance that Medicare beneficiaries purchase, and it is provided by private commercial insurance payers. Yeah, it's a premium the patients pay, which covers some things that above and beyond what Medicare provides.
Right. Have you worked on a Medicare Advantage cases at all? I know we did a piece just looking at what some of the insurers were being accused of using algorithms and data mining to get these high value codes so that they could get sort of higher claims from the CMS. Have you worked on any of those?
Yes, Foral Data Intelligence has worked with Medicare, Medicaid, Med Supplement, commercial, and ACO claims, and they all have different flavors of fraud, just because of the type of plans they are.
Okay, and then I know you sort of said you had a sort of particular interest or specialty in opioid fraud. I wondered if you could maybe expand on that a little bit, and what's happening there in terms of the opioid crisis and what sort of fraudulent activity was occurring.
Yeah, so opioid fraud is a little different than other fraud because it involves not just the providers, it also can involve a patient. It could involve a pharmacy or a pharmacist. So it's a combination of all the 3 or 4 parties coming together to commit a fraud, and tracking that lifeline of that fraud is complex just because multiple parties are involved, and that makes it a little bit hard. For example, a pharmacist may be selling some of the drugs in the black market, a patient may be pretending to be sick and getting the prescription which he's selling the drugs on the market, and the providers may be oversubscribing just because they have an incentive to oversubscribe.
So how would, I mean, so in the case of AI, I mean, how would AI detect or prevent fraud in that case?
So like I mentioned, AI technology uses all claims and looks at by providers. So now we are trying to build a story around this provider's opioid treatment behavior or a billing behavior. And once you have that, then you kind of trace back to see is it the same patient? Is the patient coming back again and again? And if we also have the pharmacy data, then we can also merge the data to see which pharmacy this is being dispensed, and is there a pattern of over prescribing, over dispensing, or under dispensing. So it's called shorting of some of the drugs. So we try to find again patterns and trends in the opioid case also.
Okay, and then I know you mentioned, I was just reading some of the stuff you've written, and you sort of mentioned, I don't know where you were citing this from, but you mentioned that in an article that 1 trillion in fraudulent, wasteful and abusive costs can be eliminated from the US healthcare system by 2030, which well, it seemed to me like that was pretty fantastic, but pretty optimistic. I just wondered whether you thought that was achievable and why.
I mean, if some of the Medicare, Medicaid big states like California, Florida, Texas, we all come hand in hand with technology companies like that, like us, and work on Medicare, Medicaid fraud, and some commercial payers, big commercial payers, working along with for technology companies like Foreign Data Intelligence. I think it's a very achievable goal.
Okay, no, that's interesting. And then the other thing you mentioned, you talked about sort of providers constantly changing. Well, I guess when you say providers, but fraudsters who are providers constantly changing their methods to avoid detection. I just wondered if you could give some examples of that.
Yeah, I mean, providers know how editing system works pretty much because they have submitted bills so many times. So they know what gets denied and what do not get denied. So they use some of those information and they do their own data mining to understand what bills can get paid, that they can keep submitting more and more of that. And they tweak the system in making sure that they submit a lot of patients with the similar bills that they know will get approved.
Right. So yeah, I mean, that's sort of, it's interesting. Obviously, the technology is fantastic in the sense of how it picks up on patterns and very quickly, and but at the same time, I guess the people who are fraudsters are also using technology. I just wondered how just your thoughts on how AI is being used by fraudsters, and how does that sort of dynamic work on your side?
Yeah, it's always both sides of the coin, right? If payers are using AI, even the providers can also be using AI to see which codes gives them the highest reimbursement, which bills gets paid easily without any rejections or without any additional inquiry into it. So they have a database of codes that they can use that goes under the radar. So they're constantly also using similar technology on the other side. So we need to keep up with what they're doing, just like they're trying to keep up with what our technology is trying to do.
So does it come down to a question of who's got the smartest AI system, or is that how it works? Or
yeah, I think we have a better advantage because we see claims in large volume as opposed to they see their own claim. So their vision is tunnel vision compared to where we see from a very broad view. So I think we still have upper hand in trying to catch some of this fraud before it gets paid.
right. So you obviously you have access to. I guess there's a lot of information out there that you can access in regards to the US healthcare system, Medicaid, and Medicare. I mean, how does that work? I mean, are you given information or data that you can work with, or is the information freely available? What does that mean for sort of privacy issues, that sort of thing?
So some of the guidelines are publicly available by the government, which we ingest it on a regular basis. As they publish new guidelines, we extract that information, all automated, and it comes into our system. As well, we need to also look into certain commercial payers, their policies also, and we need to ingest that. And when we have those guidelines ingested, and then we receive the claims from our clients, from our payers, we are looking and comparing against the guidelines that the federal government has regulated, state governments and federal government, as well as the commercial policies. And that's when we then see the outliers and the trends and the anomaly behaviors.
Are there regulations now? I mean, of the government sort of just in terms of AI and what can and cannot be used yet, or I assume policymakers are still working on that kind of thing?
I do not think so. In fact, government encourages to use technologies and predictive analytics and advanced technologies to help fight the fraud. It's even we identify, that doesn't mean someone is a fraud. There still needs to be some investigation that goes on. So there is always a human element on the other side of those fence, where we trigger a flag or saying something looks suspicious, and then the investigation starts. And that cannot be automated, at least for now, to pinpoint and say this is a fraud. We need to build evidence. We need to build a case to make sure that that is a true fraud and that can be pursued.
Right. So it just points to the facts, and then you can use those facts to prosecute.
Correct.
So I was also just wondering, again, I guess like any technology, prices go down, but at the moment, I mean, for your clients or for people who want to use AI to prevent and detect fraud, I mean, how costly is this at the moment?
Foreign data intelligence has made it extremely accessible by all payers. We want to do good with this technology, so it's not expensive. It's not breaking the bank. It's adding to their existing system. We are sitting on top of their system or integrating with their system, so that we are not interrupting or disrupting their existing workflow. So we want to be the almost, I call it a virtual SIU. We are having an eyes on everything that is going on in the payer space to help them identify fraud prevent the fraud before it happens.
Okay, that's really interesting. Thank you so much for talking to me today.
Thank you.
I do appreciate that, and thanks to our listeners as well. You can find this podcast along with all other episodes of Fraud Talk on ACFE.com, Spotify, iTunes, or wherever you listen to your podcasts. This has been Paul Kilby signing off. Thank you.